I'm Tom Silver, president of CR&T, the Cancer Research and Treatment Fund. Thanks to generous friends like you, CR&T has been advancing cancer research for over 50 years. Since 2011, our primary focus has been the Richard T. Silver, MD, Myeloproliferative Neoplasm Center at Weill Cornell Medicine. At this world-class center, gifted investigators are conducting cutting-edge research and giving outstanding care to patients with these blood cancers. Today, I'm proud to introduce you to one of these patients, Ruth Fein Revell. Ruth is an accomplished health sciences writer whose work has appeared in the New York Times and many other media outlets. The many health challenges she has faced, including 25 years progressing from one MPN to another, in addition to early colon cancer and now myelofibrosis, have made her a dynamic MPN patient advocate. In this video, she speaks about her MPN journey and the Silver Center's impact on her life. Ruth is just one of many patients who have benefited from the compassionate care and expertise provided by the Silver MPN Center. We hope that you'll consider supporting this important work by making a donation to CR&T. Thank you, and from our CR&T family to yours, warmest wishes for a very happy holiday and Happy New Year.
Earlier this year, I asked my hematology oncology specialist, our own Dr. Ellen Ritchie from Weill Cornell, what her notes implied when I first took the train 180 miles south for a consult. I didn't ask my prognosis at the time, and she didn't offer it. But by the time I left her office 24 months ago, I was signed up for a 2-year clinical trial that would change my life. I've had a diagnosed rare blood disorder, an MPN of one type or another, for nearly 30 years, long before the World Health Organization reclassified them as blood cancers. I still prefer not to use the cancer label, as it implies an acute condition, something we want to immediately cut out, to kill off, to rid ourselves of. A chronic cancer, like an MPN, is different. You live with it as an everyday presence. You aim to control your symptoms. You take the drugs your body may respond to in the short or long term. And while the uncertainty is palpable, you choose to live with hope for the future. And for me, that has paid off. The combination drug study I'm participating in has actually been reversing the fibrosis or scarring in my bone marrow from a stage of intermediate 2 to near 0. Dr. Ritchie has actually called me the poster child for participation in clinical studies. We all make choices, and I didn't think long about this one. I trusted Dr. Ritchie's insight and instincts that I was a good candidate for this drug therapy. One reason, her personal style of medicine. She spoke to me not as one of a long list of patients waiting in 18 exam rooms. I never feel as if she or anyone at the Silver MPN Center ever sees me that way. I'm truly seen as Ruth, the person behind the blood work, behind the mask, me as me, who also happens to be a person living with myelofibrosis after it progressed from essential thrombocythemia and polycythemia vera, and after bouts of dangerous blood clots and lifelong debilitating headaches, after misdiagnosed perpetual bone pain, and the kind of fatigue that kept a one-time marathon runner to slow, short walks around the block. I always fully intended to dance at my son's weddings, to meet my yet-to-be-conceived grandchildren. I was simply not going to have it any other way. Even when my condition, my symptoms and complications offered, at least on paper and based on old data, a median survival of 16 months, a prognosis that is now outdated because we've learned so much about MPNs in just the past decade through the advancement of research, clinical trials, and better treatment options. But my approach to my health is not surprising. It's simply in my DNA. I'm the daughter of an astoundingly strong 88-year-old mother and a glass-filled to the brim father, both first-generation Americans. I'm a proud mother of 2 amazing young men and the wife of an ex-Brit, the love who stole my heart at age 53. But who am I really, beyond someone who thinks the world of the specialists and the entire staff at the MPN Center at Weill Cornell? I'm a lover of music, the arts in all forms, nature, cycling, and breathing. And I'm always a writer. Though my 6th grade teacher would still be a disbeliever, I've made a living as a writer since my, quote, portable computer required a 2-foot tall bag and all of my strength to carry it over my shoulder. But what does all this have to do with MPNs and research and people living with a rare blood cancer label? This past year, I wrote my personal MPN story for the New York Times. It started out in their Thursday Well newsletter and ended up an editor's pick on the Sunday homepage. Though I had written and covered stories for the Times over the years, that single day felt 100% like my greatest professional accomplishment. And it wasn't the Sunday byline. It was the hundreds of comments posted on the Times website, the number of emails and texts and tweets. It was the outpouring of thanks, gratitude from others with an MPN, and a number of practitioners. While it was difficult to share my story so publicly, I felt it was a unique contribution I had the opportunity to make. I could offer perspective to people who don't have access to MPN super specialists like at the Silver Center. I could do my part to help change the conversation around a chronic cancer. Most important, this piece could be shared with family members and friends who don't know that sitting in a recliner might be the best thing some days because the fatigue simply needs to be given into. They may not know much about their loved one's condition, or they may have heard blood cancer and never moved beyond the associated terrifying fear. It was exactly 1 year ago when I pitched the Times editor with my story, and I knew then exactly what I wanted my messages to be. 1, that I have a rare blood disorder. 2, I'm a poster child for hope through experimental drug trials. And 3, I will dizzy myself silly dancing on my toes at my son's twice postponed wedding. Thank you to the Cancer Research and Treatment Fund for all you do. And thank you to Dr. Richard Silver and Dr. Ellen Ritchie and colleagues, and all of you for supporting research, treatment, and hope for people living with a myeloproliferative neoplasm, shining a spotlight on MPNs right alongside so many well-recognized cancers. From the top of my head to the tip of my toes that I did in fact dance on at my son's wedding just 8 weeks ago, I thank you for your passion, your perseverance, and our progress.